Greetings to all viewers. Today, I would like to talk on pelvic pain, a very common problem that is faced in our country, which has got a lot of misconceptions in it. I'm Dr. Shobana Mohandas. I'm a gynecologist and laparoscopic surgeon from Thrissur, Kerala. And this topic is very vast. I cannot complete all of the diagnosis, but I would like to certainly remove a few misconceptions and bring to light a few practice points which are not usually practiced. Pelvic pain is generally because of either infection, endometriosis, where the blood comes through the uterus into the abdomen and sits as red spots here and there. That's endometriosis. Of course, whatever can be found on scan, like fibroid, ovarian cyst, and all is there. I won't be talking on that. But yes, bowel adhesions and myofascial problems are other problems. The crux is that the causes of pelvic pain is difficult to diagnose an ultrasound all the time. And when there is no ultrasound diagnosis, the patient does not agree that it is a right diagnosis. Pelvic inflammatory disease can be caused because of infection in the endometrium, which is the lining of the uterus, salpinx, which is the tubes, tubo-ovarian complex, or the peritoneum surrounding. So anywhere there is an infection, she gets lower abdominal pain in 68% of times, low back pain in 58% of time, vaginal discharge in 52% of times, low-grade fever sometimes, malaise, and painful intercourse or even infertility. It's quite often misdiagnosed as gas. They just say, I've got gas. Or at the most, they'll say, I've got urinary infection, doctor. They only know one thing, and that's urinary infection. But it's not always. Your urinary tract is different from the pelvis, and infection in the pelvis is different. But the minute you tell them the infection is by the side of the uterus, a patient is alarmed. The main two questions asked are, how did I get it? Second is it a serious problem? Will my uterus be removed? Anything that happens to the uterus, people think the uterus has to be removed. And will I get infertile? No, the answer to all this is no. Infection, just like cold or cough, can be treated by corona. Everything can be treated by antibiotics and anti-organism medicines. So even pelvic infection is because of infection, it can be treated. How did it come? The infection generally starts in the cervix, which is the mouth of the uterus, and goes up, involving the tubes and other parts. And the organisms just travel up from below. The organisms do come from the husband or the partner. But the woman should be having a genetic predisposition to have less immunity so that the infection comes there. There are some toll like receptor genes in these women. That's where they get it. So even if the woman is prone to it, definitely the gynecologist can look after her. Only thing is, how did I get it? How did I get it? Why worry about it? How can I get rid of it? How can I get rid of it? That should be the question. Yes, the net is full of places which say that the partners are the cause of it and multiple sex partners cause it. Let me tell you, most of the gynecologists in India will vouch for the fact that unisex practicing women do have pelvic infection. Yes, it does come in young age, but also comes in older age. It's not necessary to have smoking or illicit drug use. And pelvic infection is not unknown in India with a fairly large safe sex, uh, you know, practicing population. So whatever is there on the net coming from the Western world does not apply to India at all. And blaming a woman for having partners because she's got pelvic infection is not the right thing to do. Yes, there can be some coli receptors in the vagina in some women, or something like, glycol sphingolipins, a type of fat with a lot of villi on it. So these women will get recurrent urinary infection. Or if they have got urinary infections constantly in childhood, or family has got infections of urinary tract, all that can predispose to pelvic infection. Yes, either sex going from back to front, or after defecation you wipe from back to front, All this can cause pelvic infection. It helps to have micturition after sex. It does help to not hold the urine too long to avoid urinary infection, which can later go on to form pelvic infection. Yes, drinking a lot of water can help urinary infection to be cured and thereby pelvic infection. Antibiotics at the drop of a hat should be discouraged so that when you have a pelvic infection, you can really treat it with antibiotics. So, when do you initiate treatment? Whenever you have abdominal pain, and on examination, the uterus pains while it is moved by the gynecologist. That is enough to start treatment for pelvic infection. You don't have to wait for an ultrasound diagnosis. It is an empirical diagnosis, and the patient will say, how do you know I have got infection? Urine is not showing anything, ultrasound is not showing anything. You just telling me that I've got infection. Yes, that is the only way that we have to give an empirical diagnosis, because hardcore diagnosis is not available for the pelvis, because you can't put in a swab inside the abdomen and take it out and find out if there are bacteria in it. Max to max, you can take out some fluid from the uterus and test. All that is, roundabout methods. And scan and CT scan may show once it is very florid, but in the initial stages, you cannot. Sometimes on a laparoscopy also you can find it out. But if oral medicines don't cure the woman, sometimes she has to be admitted. Either she does not respond to it, or she's got so much of vomiting and so she can't tolerate it, or she's got high fever, or she's got abscess. All this requires admission. Sometimes, very few times in my practice, I have had to use a laparoscope to remove the pus from the abdomen. I'm very sure medical college doctors will see more of it because the poorer population reaches there. Pelvic abscess is not unknown and surgical management has to be needed. So you cannot procrastinate. You go on taking drugs, and if it doesn't work, you still wait. That's not the done thing. If it's not working, you have to admit and see. Now, everything is not as it seems, like you can see here. So, I had a patient who had come to me with abdominal pain, and she was taken on antacids and some stomach pain drugs. See, that hand has got just cream on it. So, she just asked me, I want reference to a gastroenterologist. But on questioning, she had pulled on a cow 2 weeks back at 65 years of age. And just giving her some pills cured her. So this was just muscle pain. So all pain is not because of great illnesses. Sometimes even small things can have problems. So there is something called musculoskeletal pain. And when you push a cupboard or you push some box without knowing it, after a few days it starts. Or even patients who have had pelvic infection long back or who have undergone section, they come to me saying, pain is not going. I've gone to 5, 6 doctors and it doesn't go off. What do I do? And when on examination there are tender spots on the abdomen, I, in my practice, give myofascial trigger point injection. And I have been giving lectures on this all over the country in practically 6 to 8 places. And I've seen gynecologists are not practicing this. It's not become very popular, but in my practice, it's very good. You just find out the points where there is pain and inject the solution, and the pain is permanently cured if it is caused by myofascial trigger points. So that comes by exclusion, by touching, and you asking her on turning if she has got pain. And if she doesn't have infection, she doesn't have endometriosis, after ruling out everything, if you come to the diagnosis of myofascial trigger points, then and only then will these injections work. But if it works, it is permanent and it's really good. Now, sometimes with all this, you can't diagnose. And there you have to put in a tube inside the abdomen that's called laparoscopy. See, this is a patient where all the veins on the side are blue in color. That is called pelvic venous congestion. There's no way you can diagnose it on ultrasound. Color doesn't show there. So here, the only treatment required is medical treatment. Even removing the uterus won't cure her because the veins are on the side of the uterus. This is the uterus, and the side is the place where she's got veins. So, certain things can be diagnosed in laparoscopy. Endometriosis also, unless there are big ovarian cysts, you can find that there are red spots on the sides of the uterus, and removing those red spots with the cautery or by removal can cure a woman and can be very useful. So this requires a laparoscopy for diagnosis. It cannot be found out on ultrasonography. Again, young women, they may have one who had come to me with history of previous section. She gets intermittent abdominal pain, and in between she's absolutely all right. So people started calling her psychotic. It's not psychotic. She just had additions of the intestine to the top of her abdomen. And because the food is passing through the stomach, then when the food passes, she gets pain. And when the food has passed off, she does not get pain. And only way to find out is laparoscopy. And releasing the additions is the only way that can treat her. This is another patient with history of multiple surgeries, and she also has got additions which can be cut and give relief for the patient. So all these things can be found out only on our laparoscope. Here again, the uterus has got a small swelling on the side which cannot be found on ultrasound. But on removing that swelling called rudimentary horn, she gets relief of severe pain during periods. So, ladies and gentlemen, this is just an eye opener to tell you that ultrasound cannot find out everything. Sometimes you do need a laparoscope. So, in short, infections are the commonest reason for pelvic pain that can be simply be treated by drugs for 15 days. Second commonest is endometriosis, and rarely you can have congestion, additions, and all those small things which I told you. Sometimes trigger point injections can help in patients with myofascial trigger points. So I just wanted to tell you about all these different things. Thank you for your patient listening, and I hope you did enjoy listening to this very common vexing problem that is called pelvic pain. Thank you so much.